Just talk to me, mate. Yeah.
So what we're looking at is the
Yep.
interosseous membrane, which sits between the radius and the ulna. The purpose of that we know of is to distribute force evenly between radius and ulna to minimize the force going from the wrist to the elbow, elbow to the wrist.
Beautiful.
So one of my thought processes was that if that interosseous membrane becomes restricted, we lose that rotation and between radius and ulna,
Yep.
which then puts more force through elbow and wrist. And generally what I'm finding is that we end up with a little bit more elbow pain, similar to things like tennis elbow, golfer's elbow, or just some tenderness in there. You might not have all the symptoms of tennis elbow or golfer's elbow, but we've got some restriction through there. One of the ways that I've been testing is to have a look at the wrist and just to mobilize the radius and the ulna at the wrist joint and see what's happening in that area. And if I'm finding that I've got that restriction, then I go ahead and do some needling into that. The point is to go into the interosseous membrane with the needle, rather than targeting specific muscles. Just having a look at that.
No. So just for people's background, so the way you, so this technique was developed because of your own issue, right? So you had golfer's elbow
in the right arm. And again, being a therapist, that was pretty common. And what I was finding was that I had a bit of restriction in extension.
Wrist.
So doing a push-up was really difficult from the right hand perspective. And it felt restricted through my wrist. The carpal bones felt restricted, and I always felt like I needed to mobilize them.
Your wrist.
And mobilize the carpal bones themselves. But what I realized as well was when I would kind of rotate like that, my whole arm had to go with it.
So you weren't doing pronation, supination, right?
And so then that led me to think, okay, what's going to restrict both the radius and the ulna so much? Because we also ultimately use our thumbs and hands a lot, the muscles of the thumb attach into the interosseous membrane. So a lot of that work that's going to be from the thumb is going to be influencing the interosseous membrane. And through that restriction of the interosseous membrane and limitation of rotation, pronation or supination, more force was going into my wrist and my elbow. Golfer's elbow for 18 months. Could not clear it.
Did everything, tried everything. The whole bit.
So had that thought, how do we get rid of the restriction in the interosseous membrane? You can't go through the muscles of the forearm to get in. Your fingers just aren't going to do it.
Correct.
So needles is the only
next best way
thing that I thought of. So I still warm up the area.
So you do a little bit of just work on the extensors.
And it's partly just to create that introduction to this area for what I'm about to do. So from the client's perspective, this is it doesn't change too much of the muscle or the tissue. But I'm also not trying to. This isn't my target area.
So when you did this, Dan, like so you obviously did it on yourself, did you?
I had somebody do it to me.
So you had. So did you go, right, this is what I want you to do. I want you to needle through here. What we're targeting is interosseous membrane. And that's sort of how it came about. You were just like, it was just shits and giggles.
Because it wasn't, it's not an area that people generally...
No, you're right, absolutely.
It had to be under instruction. And being done to me so that they were comfortable enough to do it. And the instructions were, you are aiming to go in between the radius and the ulna. So you move past the muscles, feel for the bones, feel where the bones are, so that when you are going to come in, and there's no specific area, but what I've been
it's not like you're targeting a trigger point or anything.
No. So what I was looking at targeting was the upper area, just below the elbow. And then sometimes I've been coming down into the lower part or the distal part of the forearm. With a little bit of the intention of hitting the insertion points of the thumb muscles.
Right. I'm with you.
So finding that point.
So, and now you've been doing this technique a fair bit now, haven't you? and getting like really great results as
Yeah,
well,
yeah.
that's awesome.
How's that feeling?
Yeah, I'm feeling it. Yeah.
So with that one, I had hit the ulnar bone, so I just needed to come back
Back
out
out
and
and
then come in
so
again.
you use the bone as sort of a bit of your guide. Yeah. Yep. Right. Good. Yeah, that's gold.
And then for the distal one, same thing.
Yep. Snap it. Yeah, it's different to needling a muscle. It's very deep and dull.
Yeah.
You know what I mean? It's not, when you find that twitch response in a muscle and you go, oh wow, and that's like, oh, I really feel. This is not like that at all.
With me, when it was done to me, it lit up my wrist.
Fair income.
My whole wrist, exactly where I was trying to mobilize,
Yep.
completely lit up.
Yeah, wow.
And it was a very, very clear. So
Yeah,
it was kind of that trigger point referral pattern.
Right, yep.
But just with an intensity of burning and just really aware of that specific location around the wrist.
Yep, right. Wow. Which is the sort of the symptoms that you were having. Because remember, you were telling me you were trying to like forcibly, when you're at the gym, trying to mobilize your wrist extension because you go, my wrist, my wrist, my wrist. But obviously, at the end of the day,
elbows, when we're talking about elbow pain, we go to the extensors and we go to the flexors, and we go to the
triceps and
supinators and everything.
Yeah.
But for me, I just kept on coming back to my wrist. My wrist was, I could feel that my wrist was my issue.
Yep.
And I'd done everything through there to try and clear that away. And so, so I went to the wrist, the point in, hit the interosseous membrane, that all lit up. It sat there for me because I had the sensation of in the wrist. I waited until that had calmed down before I had the needles.
So everything's subsided.
Yep. How's that
How long?
feeling for you?
Yeah, no, it's good. How long did that take, do you reckon?
I would reckon they were in there for a good 2 to 3 minutes.
Yeah, right. Okay.
If not a little bit longer.
Yep. Okay.
I was having a good old chat.
Yeah. Obviously, you were saying, "Oh my God, you should see what I'm feeling." Like, I know I'm feeling that more now.
Yeah. And sometimes as you're coming
that's
out,
actually down into my hand.
Yeah. As you're coming out, you can kind of initially go through the interosseous membrane. But as you come out, you actually get the needle point in the membrane itself, which hits this. Obviously, you've got some nerves, things like that.
Sensory nerves. Yep. Of course, as you do in needling.
And I haven't.
God, that's like my full forearm. I can feel that all the way through my full forearm.
I haven't done any of the, fish in the hole. Or
no.
What they call it. I'm not trying to find trigger points. Because I can't help to find them anyway.
No.
So it's that technique of just knowing where the area or the tissue that you're trying to target and getting the needle into that tissue.
Yep. Which somehow resets the tension monitoring mechanisms of the tissue. That's what I feel anyway.
Yeah.
So you just like deactivate it, don't you?
Yeah.
Sort of thing.
Yeah.
And then
overload it, deactivate it.
Yeah, wow.
How's that going?
Yeah, it's completely subsided now. It was my full forearm. Oof. That's back on. Yeah. And then you do a bit of soft tissue. Yep. And then that's basically it.
And that's really it.
Fair income. And then you and you mobilise,
and see if there's any change. And that ulna for you is there we go.
Yeah, I know. There it is.
And that radius is now moving much better to those carpal bones.
That's good for Stu.
Yeah.
That's great.
How does that feel?
Yeah, awesome. I can't wait to get in the clinic and try that now. Yeah, that's a gold. Righto. Interosseous membrane.